STD symptoms in men can be diverse, meaning some men may only have a few symptoms and other men may have a lot of symptoms. Some men have mild symptoms and other men have severe symptoms, but it all depends on the STD and their particular person. Today I'm going to discuss 5 of the most common STDs a man could develop, and most importantly their symptoms, because you want to be able to recognize these symptoms because you don't want an untreated STD wreaking havoc on your body. With that being said, let's talk about STD symptoms in men. Big shout out to Letsgetchecked for sponsoring this video. If you're ever interested in getting an STD check in the privacy of your own home, check them out because they are freaking awesome. I left a link in the description if you're interested, and also a discounted code to help you guys out. With that being said, let's get started. This video is going to give you some valuable information about STDs, and if you find that you have a few of these symptoms or a lot of these symptoms or maybe just one of these symptoms, definitely talk with your primary care provider because you don't want to mess around with STDs because they can cause a lot of complications in some people. If you enjoy this video or you want to support my channel, please like and subscribe below. The first STD we're going to talk about is gonorrhea. Gonorrhea is the second most common bacterial sexually transmitted disease, and it is curable, so you want to get treated. Symptoms a man could develop due to gonorrhea is pain with urination, thick penile discharge, could be yellow, white, or green. Some men could develop burning or itching at the tip of the penis. Some men could develop testicular pain. This is more rare. And at the end of the day, a lot of men are asymptomatic. If you're wanting more information about gonorrhea, I did a thorough video on gonorrhea right up there. Check it out. Next sexually transmitted disease is the human papillomavirus, also called HPV. In the United States, this is the most common sexually transmitted disease out of all of these sexually transmitted diseases. This STD is from skin to skin contact, and most people who are sexually active will get HPV in their lifetime. The good news is most people fight this off on their own without any medications, but sometimes people can have this for their whole life. Some things a man could develop due to HPV are genital warts. These kind of look like these little skin tag lesions. They could be located all along the penis or in the groin area. Some men only have one and others may have a ton of them, and some men have none. Other men could be completely asymptomatic due to HPV. Other men could go on to develop mouth cancer, throat cancer, or even penile cancer. The next STD we're going to talk about is syphilis, and syphilis is nicknamed the Great Imitator because it can have a crazy amount of symptoms and look like a lot of other diseases. Syphilis also has different stages, which is different than other STDs. With each stage, you could have different symptoms or no symptoms at all. It starts with primary syphilis, then it could progress to secondary syphilis, then it could go into latent syphilis and also tertiary syphilis. But each stage could potentially be stopped with antibiotics, which is why it's so important to get treated as soon as possible. Primary syphilis symptoms usually include a canker on the penis, and you may be thinking to yourself, what the heck is that? We're going to talk about that a little bit later. But the incubation period of syphilis is around 21 days. So what does incubation period really mean? That means from the time that you were exposed to syphilis through sexual contact, it takes around 21 days to develop a canker. It starts off with this small papule, which is a little bump on the penis. Then what happens is it ulcerates and it creates these ridges surrounding the ulceration. That lesion or ulceration is called a canker. It's painless, but you could also have some regional lymph node swelling, meaning swelling of the lymph nodes in the groin area. Also, a canker can pop up in the mouth and in the anus in men. Again, if left untreated, it can move on to secondary syphilis weeks to months later. Secondary syphilis symptoms can include a rash, which is these reddish brown spots on the palms of the hands and the soles of the feet that aren't itchy. Somebody could also develop fever, severe fatigue, weight loss, muscle pains, lymph node swelling, headaches, patchy hair loss, and several other potential symptoms. Again, if secondary syphilis is not treated, it can move on to latent syphilis, in which people don't have symptoms for a long period of time potentially. If the symptoms return, this is considered tertiary syphilis, and this can wreak havoc on the body. This stage of the disease can cause damage to the eyes, the brain, the bones, the liver, the blood vessels, and tons of other areas in the body. As a result, people can have various symptoms, and so today we just can't get into those because there's so many. The next STD we're gonna talk about, we all know it, and it's the most common bacterial STD, and that's chlamydia. Chlamydia symptoms in men can include pain with urination, penile discharge, but a lot less than gonorrhea, burning or itching at the tip of the penis, testicular pain, this is rare, but a lot of patients are asymptomatic. Check out my video on chlamydia or chlamydia in men because that goes a lot more in depth if you're concerned about chlamydia. Next is genital herpes, and this STD is quite concerning for a lot of people. It all starts off with a primary infection. And what is a primary infection? A primary infection is the first genital outbreak somebody does get. It usually presents around 4 days after exposure to somebody who's positive for genital herpes. After the initial infection, the primary infection, it goes into a latent state, meaning you don't have any more symptoms. Then people can get recurrent episodes, months, years down the line, but some people may be asymptomatic for the rest of their life. If somebody does get a recurrent outbreak, the symptoms are much more mild in most people, which is great. But remember that there is no cure for the herpes simplex virus, genital herpes, so that's why a lot of people are concerned about this STD. Signs and symptoms of a genital herpes primary infection can be severe, and signs and symptoms can include a fever, severe fatigue, headaches, muscle pains, local swelling and pain in the groin area, lymph node swelling in the inguinal area, and then also the characteristic lesion of a genital herpes outbreak. The classic genital herpes lesion or lesions can be quite complex. They first start off with these fluid-filled vesicles that are clear or yellowish in appearance. Some people call them blisters. They rupture, then they kind of ulcerate and then scab over. This can pop up on the penis or in the groin area. Symptoms of a genital herpes recurrent infection is much more mild in most patients. Now, some patients have pain and tingling before the lesion pops up, then the lesion pops up, and the good news is it usually resolves a lot faster in comparison to the primary infection, and a lot of times patients don't have any fevers, headaches, body aches, or any of the other stuff. I'm gonna reiterate, if you're having multiple sexual partners or you're having unprotected intercourse, it's very important to get screened for STDs routinely. Many people may be embarrassed to talk about their sexual history with another provider, especially in person, because these are personal things and a lot of times these can be embarrassing. An awesome way to get checked for STDs privately in your own home is through Letsgetchecked. They send you a box through the mail, you do your tests at home, and you simply send it back. It gets sent to an accredited lab and you get the results through their app or if you just log in online. If you're interested, I'll leave a link below in the description section because this company is pretty dang awesome. Now remember, I always recommend that you see your primary care provider if you're having symptoms. That is critical because if you're having symptoms, you need to get treated as soon as possible. Remember, a lot of STDs, you can be asymptomatic. So if somebody has multiple sexual partners or you're having a lot of unprotected intercourse, it's always wise to get routinely checked. Also, this is great if you're just curious about if you have any STDs or if you're starting a relationship with someone new and you want to make sure you're clean, this is a great option. That wraps up today's video on STD symptoms in men. I hope you learned a thing or two. If you enjoyed this video or you just want to support my channel, please like and subscribe below. Until next time, take care.